Deep vein thrombosis, or DVT, is a serious medical condition that occurs when a blood clot forms in a deep vein, usually in the legs. Earlier this week, we learned about Victor Wembanyama is out for NBA season due to DVT. We are going to dive in on this issue. What is thrombosis and how can you treat it? These veins are responsible for carrying blood back to the heart. When a clot forms, it can partially or completely block the flow of blood, leading to a range of symptoms and potential complications. Imagine a traffic jam in your veins. This is essentially what happens in DVT. The blood flow is disrupted, causing a buildup of pressure and potentially leading to serious health problems. DVT is a relatively common condition, affecting millions of people worldwide each year. It is important to be aware of the symptoms and risk factors associated with DVT so that you can seek medical attention promptly if needed. Early diagnosis and treatment are crucial in preventing potentially life-threatening complications. One of the most serious complications of DVT is pulmonary embolism, or PE, which occurs when a blood clot breaks loose from the vein and travels to the lungs. PE can be fatal, so it is essential to seek immediate medical attention if you experience any symptoms of DVT. Recognizing the symptoms of DVT is crucial for early diagnosis and treatment. The most common symptom is swelling in the affected leg, which may be accompanied by pain, tenderness, or a feeling of warmth. The pain may feel like cramping or soreness, and it often starts in the calf. Changes in skin color are another common symptom of DVT. The affected area may appear red, bluish, or purplish due to the reduced blood flow. In some cases, the skin may also feel warm to the touch. It is important to note that these symptoms can vary from person to person, and some individuals may experience no noticeable symptoms at all. This is why it is crucial to be aware of the risk factors associated with DVT and to seek medical attention if you experience any unusual leg pain, swelling, or discoloration, especially if you have any underlying medical conditions or risk factors. Early diagnosis and treatment can significantly reduce the risk of serious complications. While not all cases of leg pain or swelling indicate DVT, it is crucial to seek medical attention promptly if you experience any of the symptoms mentioned earlier. This is particularly important if you have any risk factors for DVT, such as a history of blood clots, recent surgery, or prolonged immobility. Certain symptoms require immediate medical attention as they may indicate a pulmonary embolism, or PE, a life-threatening complication of DVT. If you experience sudden shortness of breath, chest pain that worsens with breathing, coughing up blood, dizziness, or fainting, call emergency medical services immediately. Remember, it is always better to err on the side of caution when it comes to your health. If you are unsure whether your symptoms warrant medical attention, do not hesitate to contact your doctor or seek medical advice. Early intervention is key in preventing potentially serious complications associated with DVT and PE. Section 4. Understanding the causes and risk factors. Deep vein thrombosis occurs when a blood clot forms in a deep vein, typically in the legs. Several factors can contribute to the formation of blood clots, including damage to the vein walls, slow blood flow, and increased blood clotting tendency. Damage to the vein walls can occur due to various reasons, such as surgery, injury, or inflammation. This damage can disrupt the smooth inner lining of the veins, making it easier for blood clots to form. Slow blood flow is another significant risk factor for DVT. When blood flow is sluggish, clotting factors in the blood are more likely to clump together, leading to clot formation. This is why prolonged immobility, such as during long flights or bed rest, increases the risk of DVT. Certain medical conditions and lifestyle factors can also increase the risk of DVT. These include a family history of blood clots, inherited clotting disorders, pregnancy, obesity, smoking, and certain medications like birth control pills and hormone replacement therapy. Understanding these risk factors is crucial for taking preventive measures and seeking timely medical attention if needed. Section 5. Potential complications of untreated DVT. If left untreated, deep vein thrombosis can lead to a range of complications, some of which can be life-threatening. One of the most serious complications is pulmonary embolism, which occurs when a blood clot breaks free from the deep vein and travels through the bloodstream to the lungs. PE can be fatal, as it blocks blood flow to the lungs, depriving the body of oxygen. Symptoms of PE include sudden shortness of breath, chest pain, coughing up blood, rapid heart rate, and dizziness. Another potential complication of DVT is post-thrombotic syndrome, a condition that can develop after a DVT and cause chronic pain, swelling, and ulcers in the affected leg. PTS occurs due to damage to the vein walls and valves caused by the blood clot and the body's inflammatory response. While PTS is not life-threatening, it can significantly impact quality of life and require ongoing management. Therefore, early diagnosis and treatment of DVT are essential to minimize the risk of these complications. Section 6. Diagnosis and treatment of DVT. Diagnosing deep vein thrombosis typically involves a combination of a physical examination, medical history review, and diagnostic tests. Your doctor will ask about your symptoms, medical history, and any risk factors you may have. They will also examine your legs, checking for swelling, tenderness, warmth, and changes in skin color. To confirm the diagnosis, your doctor may order imaging tests such as an ultrasound, which uses sound waves to create images of the veins, or a venography, which involves injecting a contrast dye into the vein and taking X-rays to visualize the blood flow. Treatment for DVT usually involves medications and lifestyle changes. The primary goal of treatment is to prevent the clot from growing larger, prevent it from breaking loose and causing a pulmonary embolism, and reduce the risk of long-term complications. Medications used to treat DVT include anticoagulants, also known as blood thinners, which help prevent blood clots from forming and growing. Section 7. Preventive measures and lifestyle changes. While not all cases of DVT are preventable, there are several things you can do to reduce your risk, especially if you have risk factors. These include staying active. Regular exercise is crucial for maintaining good blood flow and preventing blood clots. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Maintaining a healthy weight. Obesity increases the risk of DVT, so maintaining a healthy weight through a balanced diet and regular exercise is essential. Avoiding prolonged sitting or standing. If you have a job that requires you to sit or stand for long periods, take frequent breaks to move around and stretch your legs. Wearing compression stockings. These stockings help improve blood flow in the legs and can be particularly beneficial for people at increased